Hello, my name is Karlee. I'm a physical therapist and a neuroscience researcher. And prior to giving you instructions on how to do this exercise, I wanted to take some time to go over some of the reasons behind why we're doing it. And that will help you to have a stronger intention when you are doing the exercise and to help you better understand the way that this exercise works and the benefits it has to your body. I also wanted to commend you for putting effort in and time in to healing whatever issue you have going on right now. I know everyone has very busy lives, and to take time to work on improving the situation for yourself, whatever it may be, is amazing. So I wanted to thank you for doing that. And I think when we spend time changing a situation for ourselves, like for example, doing things to improve the pain that we're experiencing in a certain area of our body, this has carryover effects to other parts of our lives, and specifically with this type of technique, you're not only going to improve the way that you feel, but also the way that you're thinking and the state of your overall nervous system. And that definitely has ripple effects into all areas of your life and potentially into others' lives as well. So thank you so much. I see you, and I appreciate all the time you take to improve this situation for yourself. So we're going to spend some time going over heart rate variability, and this is some background for you to understand why we are doing this technique called heart coherence. And the specific technique that we're doing is through heart math. This again is not a technique that I have developed, but one that I found the most research to support and that I find to be very effective in helping bring the nervous system into a more balanced state, which will have effects on things like pain and movement, etc., etc. So when we talk about heart rate variability, this is the time difference between each successive beat. So when we see that on this graph here, all of those spikes there in the signal, that's the beat we're looking at here. And we're looking at the time difference in milliseconds between beats. And that is what heart rate variability is. And this is influenced by stressors in our life. And the heart rate variability is also an index of the state of our autonomic nervous system. And our autonomic nervous system is the system in our body that governs the function of our organs and glands. And it's connected with systems like our emotional systems and our musculoskeletal system as well. So this autonomic nervous system is how the emotional system in our brain, one of the ways that it operates through our body is through the autonomic nervous system, as well as the endocrine system, which is the hormonal system in our bodies, and through the musculoskeletal system. So heart rate variability has been found to correlate with health and well-being, emotional regulation, postural control, cognition, attention, reaction time, memory, executive function, among other things. And we know through research that having a high heart rate variability is associated or correlated with improved health and well-being, as I mentioned, lower levels of worry and rumination, lower anxiety levels, and then generally more regulated emotional responding. And what we see here in this graph or this figure is that these two heart rate tracings are both at 60 beats per minute. So both these individuals have a heart rate at 60 beats per minute. But what we see is in an individual, when they're in a relaxed state, we see this greater heart rate variability in between beats, that time period is higher variability. Whereas what we're seeing here in the stressed individual, or an individual that is experiencing stress, is that we have a lower heart rate variability. So it becomes more rigid, and there's less variation from one beat to the next. So what they found in the research is that individuals, when we are experiencing emotions like frustration or anxiety, worry, etc., we have this more incoherent rhythm of the heart where we're getting this lower heart rate variability. And what they found is that this impairs performance. And this is not only on physical tasks and reaction time and that type of thing, but also on cognitive tasks like memory, executive function, etc. When individuals are spending time in these positive emotions or regenerative emotions, I should say, like emotions like love or care, gratitude, appreciation, these are states that bring about this more orderly and coherent rhythm in our heart. And what we see is this higher heart rate variability and this coherent state where we're seeing this more, again, orderly rhythm. And this promotes a very coherent state within our body system. So it's a state where we're getting this improved performance. So this promotes optimal performance. And again, that's on physical tasks, on cognitive tasks, etc. So it's important to note that the heart is always sending information through signals to the brain. And that's happening all the time through the vagus nerve. So information is received from the heart by the brain. And this significantly affects the cognitive processes in our brain, how we're interpreting sensory information, so things like light, noise, the sensations that are being carried up through nerve endings in our skin, in our joints, in our muscles, etc. It will affect pain perception, how we are thinking, how we're feeling, our breathing, and many other things. And so this is why it's very important to do a technique where we can really help to bring this system into balance, so that we can, one, perform optimally at whatever task we are trying to do, whether it be physical or mental tasks, and so that we also can influence the way that we are experiencing or perceiving pain. So learning to generate this increased heart rhythm coherence by sustaining these positive emotions not only benefits the entire body, but will have profound effects on how we're perceiving things, how we think, how we feel, and how we perform. So we're going to be doing an exercise called the heart lock-in technique. And again, this was one developed by HeartMath. And it is a very, very helpful technique. And you can do it as an exercise. And I will go over this more when we actually go through the steps. But you can do it as an exercise every day. Or you can do it as an exercise and situationally. So if you know you're going to be doing something that typically aggravates your symptoms, you can do this beforehand. And you can bring this into other areas of your life, like work. If you know you have an important presentation coming up to your colleagues, doing a technique like this beforehand where you're getting yourself into a very relaxed, balanced state can really help you perform the way you want to on that task. So we will go into it now, and I hope you enjoy.